there are some businesses in BC who are laying out this policy that they would only hire employees who are vaccinated, and some of the businesses I have spoken to have gone to the extent of saying their present employees that they would be fired if they don't get vaccinated. Is this something that you encourage?
Yeah. So, our role is to look at health. But yes, these are the things that businesses need to make decisions based on the risk of their business and the risk to their business. As we just talked about, in some areas, if you have people who are coming in who are non-immunized and who cause an outbreak in that business, that can be very severely impact the ability of the business to function. And we've seen that, as I mentioned, in places like some of the restaurants, etc., in the central Okanagan. So these are business decisions that they need to make in conjunction with their own labor lawyer advisors. But I do think it is a perfectly valid thing. We also need to look at, how do we ensure that places like the arts, if we're having high-risk settings, and we're talking through this, what does it mean to have a high-risk setting right now with 80% of our population immunized, and reducing the risk for those people, where a small proportion of people who might bring risk into those settings. So those are all discussions we're having.
Do you have a follow-up, Jawad?
Yeah, thank you. So just to understand it better, even if businesses are non-essential, they are well within their right to impose such a rule on their current employees to be vaccinated to be able to work there.
Absolutely. Absolutely. I think that is a business decision. And I've had discussions as well with other groups like faith leaders and how to encourage only immunized people to attend services. Those are decisions that faith leaders, communities, church groups, choirs make for themselves, understanding their communal risk. They don't need an order for me to do that. Those are things that businesses, communities, groups can do together to collectively reduce their risk